to enter university, you need to go for health checkup. So I went to a clinic, and to my surprise, they said I got hypertension. Without knowing anything, so I was like, okay, I got hypertension. So they just bring medication, so I just take my medication without thinking too much. I said, okay, fine, because I said to myself, don't worry, I'll be fine. So I think about 4 years after that, then I start working. Before that, I was taking the medication. The doctor at the university gave me the medication for twice a day, so I need to take twice a day. And then when I start working, it was also another requirement for you to do another health checkup. So they say, hey, you got hypertension, but you can we can give you another brand that you only take once a day.
Yes.
So I was like, okay, fine, it's once a day better than twice a day. So, you know, you've been taking that for about 8-10 years kind of thing. But every time when you got to a clinic, the doctor said, I need to increase your medication. So I was like, what's wrong? But she didn't tell me that much. No, we just need to increase it so you'll be fine. So I said, fine, until I was like, no, there should be another solution than this. I can't take this medication for a very long time. And one day when you see online, there's a promotion online about Heal Withine, that's where I start. I think I can get another, what you call, like a second opinion. What's wrong with me? Beside my hypertension, my PCOS, also my allergy. That's where I landed here. I suppose during the consultation, he was looking, I think I spent like 2 hours just talking during my consultation. He was explaining A to Z. So you're like, it's like mind blown. You're never, like a doctor would sit beside you and tell you A to Z, what's happening to you, what's going on through you, what's going on with your body, because you yourself, it's not that you don't take care of yourself, you don't know, but you're just not, like the other doctor just don't care to sit and tell you, look, this is what happened to you, this is what you should do. No one did that. Okay. But with Dr. Lee, he tell you, he logically break down in a simple word that you can understand.
In other words, he told you, okay, that you have high blood pressure condition.
Yes.
And then he probably explained to you what is the cause of that. And then broken down what is the root cause of that.
True.
Then probably he explained to you that why just consuming medication will not treat the root causes.
Correct.
He explained to you that.
Yes,
correct?
he is correct.
And then and so because of that, that made sense to you that just consuming medication is not going to solve your problem. Correct.
Correct.
And that is the reason why your medication dosage was increasing.
Yes.
And probably if you pursue that path, it would just lead to an infinity increase.
Yes.
Right? And so that is the reason probably which got you to
it makes sense.
Makes sense, and then build that trust, and then in the manner in which he explained to you. So would that be correctly?
Correct.
Okay, wonderful. So that is the reason why you had that trust to proceed into the treatment. Correct.
So if you start from the start, because doctors start me slowly on detox package. So what you call just the basic one, then the intermediate one, then the advanced one, slowly. Within that 3-4 months, I think by early 2013, somehow, because of the detox, and also I also measure my high blood pressure within that 3-4 months vigorously. That means 3 times a day. So I saw some changes. I think Dr. Lee also saw the changes. So somehow he made the decision to stop my medication on the 4th month. So I was like, huh? Is it true? Ken? because I wouldn't believe it. So
the fourth
one, yeah, you
no
stop.
medication.
No medication for high blood pressure.
That was like something very thrilling to you.
Yes.
You've been consuming medication for the last 13 years.
Yes.
And you could probably save a hell of a lot of time if you probably came to Heal Withine earlier.
True.
And within 4 months, your problem could be solved. Right? So 8 years, you're popping in.
Yes.
Okay.
After that, okay. So because hypertension was already good and so on. So and then he tried with work on my allergy and PCOS.
Yeah.
So that time also again it starts slowly. Of course, you have to do your blood tests. You have to do your checkup. Of course, there are nutrition therapy. Doctor call it nutrition therapy. Yeah. And then supplements and so on.
To summarize, is that your treatment was basically detox and nutrition therapy and probably a little bit of some medications.
Yes.
And then definitely an adjustment to your food.
Yes, correct. Lifestyle too. Yeah.
And,
in 2014, I think middle somewhere, when I lost my mom, it's a big blow to me. You're kind of lost yourself. You're like emotionally, mentally depressed kind of thing. So I still come and visit Dr. Lee for my periodical checkup, like 3 months kind of thing. So by that time, in between that, doctor was talking about I think you have diabetic by that time, because before that I was okay, but because going through life, and they were like and then I think I was away for a while and I come back to Dr. Lee, and then after my wedding and stuff, I start, doc, I need help for my diabetic too. I was like in between pre-diabetic and diabetic, so it's not so high. I still can control it. I'm already taking medication that time. I said the medication will help, but hopefully we could help you again, like what we do for your hypertension. You don't need to take the medication for that long time. So it also need a commitment from me to change the lifestyles, your stress level and sleeping. Then you'll be okay. So at the moment, I still take, I think, very low dose of the medication. So just to get on with life and stuff, it is okay. Basically hypertension. After I went treatment here for about 4 months, it stopped because of the changes that you see through the hypertension, off the medication. By the end of, I think, 2013, you already changes to your PCOS, the woman issues and stuff.
Yes.
Your allergies start to what you call decrease. So it's not because you eat seafood you got the allergy. So you said no,
which
totally
is
not.
What you were
You were thinking.
Yeah.
You was like in the past. So I was like, no, it's not. It's some other thing. So after, I think, about 1 year half. So basically, I mean, in terms of PCOS, is much better. But because I still have PCOS, is a long-term, what you call is a long-term condition.
Yeah.
So it will take time, but somehow I feel much better. It's good.
Yes.
Yeah, it's good. So it's
improved much
better. Yeah,
So
it's
that
much better.
That brings much peace and joy to you. And your allergies. Allergies also are much better or resolved?
I could say like 80%, 85%. So you don't really have like every time, every night you have this I don't know, allergy. Sometimes it just like pop up in your body, and some, now you're like 85%, more or less, almost there. So it's good.
Okay.
It's good to hear that. it's also important. Commitment is basically up to you. If you want to get well, you should put a little bit commitment. You should put a bit of work to do it to achieve your goal.
Yes.
For me, it does play an important role. Compliance, again, as you want to get well, as part of your health goal, you just do what you need to be done.
Yeah. Follow it. Follow
just follow the description. If somehow in the middle you feel that I can't do this, just talk to your doctor. So he'll find a simpler way that you somehow can do it. It's achievable actually. Put it this way, David. Simple. During your during your treatment, let's say if Dr. Lee say your treatment will take about 3 to 6 months, just stick to whatever supplement nutrition that he give you until he tell you you're really well. Then after that, it's up to you. So during that time, just commit yourself to whatever he give. That's what I would say.